There can be some post-operative complications. You do not specify them on the basis of open or laparoscopy, but there can be some complications. There can be post-operative fever, there can be chills, there can be abdominal pain, there can be post-cholecystectomy syndrome, in which the patient can experience the same symptoms even after the removal of the gallbladder. And the morphology or mechanism behind that is like there can be some stone in the common bile duct, or there's a de novo formation of the stones within the biliary channels. So the patient can actually develop the post-cholecystectomy syndrome. There can be jaundice, obstructive jaundice, because if there is a biliary leak, or there is a damage to the bile duct, so the patient can actually present to you with a jaundice and abdominal distension, or you can say a bilioma can be formed, which is a complication of the bile duct injuries. And if we actually classify these on the complication of the surgery and the complications of specifically the cholecystectomy, there are the classifications basis on the bile duct injury. So there is Strasbourg classification of the bile duct injury, and he has actually classified these injuries A, B, C, D, and E. In E is subclassified. So in the A, if you talk about the A is only there is some kind of a biliary leak from the cystic duct, and in B there are some changes. In class A, there is some of the damage to the stump, and the cystic duct stump is being actually causing a biliary leak. And for the treatment for this is a ERCP, or you go for a sphincterotomy. In class B, there is the presence of accessory duct, and there is obstruction of that accessory duct, and that obstruction of that accessory duct can lead to the jaundice. And in class C, there is injury, or you can say the whole of the accessory duct is being avulged, and this is categorized as class C. So in B and C, you do the hepatoduodenostomy. And in class D, there is partial obstruction of the common bile duct. And in E, there is complete obstruction of the common bile duct. And in class E injuries, when there is complete obstruction or a complete avulsion of the common bile duct, the possibility is that the surgical options you have available is like you have to treat your patient with a Roux-en-Y hepatoduodenostomy, or you have to do the primary repair. In class 4, you have to do a primary repair with the T-tube placement. So to know about these complications is very, very much important. So the treatment of the bile duct injuries, depending upon their class A. Class A is being treated by ERCP or sphincterotomy. Class B and C, they are being treated by hepatoduodenostomy. Class D is treated by a primary repair and T-tube placement. And class E injuries are being treated by Roux-en-Y cholecystectomy. So this is a picture of a cholecystectomy, in which what was happened, this was the part of the resected liver. And what you do is you create the anastomosis between this part of the liver and the duodenum. So this is a duodenostomy, okay? This is hepaticoduodenostomy. And this was the afferent loop, and there was this was the fourth part of the duodenum, and then the duodenum as well. So you do a duodenostomy and you do a cholecystectomy. That means you're actually bypassing this part of the duodenum, and you're actually making the secretions to come down all the way to the duodenum. So this is called as Roux-en-Y cholecystectomy, and it is performed for the class E bile duct injuries post-operatively. Okay, so there can be some late symptoms after the cholecystectomy, like the post-cholecystectomy syndrome, or like the bile duct strictures. As already been described, the post-cholecystectomy syndrome can be because of the de novo formation of the cholesterol in the bile duct, or maybe possibly you have resected the common bile duct, but there was a chance that you did not actually figure it out. There was a stone in the bile duct, or there was a stone in the hepatic duct all the way. So that can lead to the development of a post-cholecystectomy syndrome, or there can be bile duct stricture formation. Later on, when you're doing a cholecystectomy or you're doing a T-tube placement, there is a possibility that the bile duct injuries are bile duct stricture is being formed secondarily to the bile duct injury or secondarily to the CVD exploration or cholecystectomy. So this was about today's lecture. We have been discussing about the cholelithiasis, their presentation, their clinical manifestation, the complications, and the conservative and a surgical treatment options we have available. In the next lecture, we'll be talking about common bile duct pathologies, and then their manifestations, their surgical options, the CVD exploration, and cholecystectomy. And we'll be discussing the indications for a cholecystectomy in the next lecture. Thank you for being with me.